Get the facts, PrEP versus PEP, brought to you by the Well for Health Promotion. PrEP, or pre-exposure prophylaxis, is a daily pill you can take to prevent HIV. PEP, or post-exposure prophylaxis, refers to taking emergency medicines after you've been exposed to HIV to try to prevent infection. PrEP is a highly effective way for people at risk to contract HIV to have more control over their sex lives and protect themselves from HIV. PrEP involves taking one pill a day. The medication prevents HIV from multiplying, which means that if you are exposed to HIV, PrEP makes it very difficult for the virus to infect your body. When taken daily, PrEP can significantly reduce the risk of acquiring HIV. PrEP works to prevent HIV, but it doesn't protect against other STIs or prevent pregnancy. You may want to talk to a Tulane provider or nurse about PrEP if you don't regularly use protection, have a sexual partner who has HIV, have a sexual partner who is at a high risk for getting HIV, have anal or vaginal sex with multiple partners, especially if you don't use protection regularly. With PEP, you begin taking pills to stop HIV infection right after you're exposed to HIV, and you keep taking them for 28 days. PEP can stop HIV if started within 72 hours of exposure, but is most effective when started within 24 hours. PEP can protect you in an emergency. And PEP might be right for you if you had sex with someone who may have HIV and didn't use a barrier method, you were sexually assaulted, or if you were exposed to HIV in the last 3 days and want PEP, see a Tulane nurse or provider. PEP is for emergencies. If you use PrEP correctly and consistently, PrEP can lower your chances of getting HIV from sex by more than 90%. It is really important to take PrEP every day. PrEP does not work well if you skip doses. If you don't take it every day, there might not be enough medicine in your body to block an HIV infection. PrEP helps you stay HIV negative, and barrier methods protect against other STIs in pregnancy. PrEP does not. PEP isn't 100% effective, and it won't prevent HIV infections like PrEP can. So, it's important to keep protecting yourself and others from HIV while you're on PEP. Tulane providers can give PrEP to students at the Student Health Center. The pharmacy also provides PrEP to all students regardless of who their provider is, as long as there is a valid prescription on file. You can also get PrEP from some local clinics or Planned Parenthood or local health departments and local providers. You can get PEP from emergency rooms. It is also available at Planned Parenthood health centers. Tip: call first to make sure they have PEP in stock. If you are taking either medicine, tell your doctor if side effects are bothering you. Visit your provider for refills and checkups. Don't stop, restart, or change how you take PrEP without talking to your doctor. After using PEP, consider taking PrEP and using barrier methods as often as possible to have safer and more fulfilling sex. Remember to always take safer sex steps to protect your sexual health.